Good morning. If you have decided to study to become a professional hypnotherapist, continue with us in this beautiful project of study and learning. Hypnosis is a powerful technique with which you will be able to help and improve the quality of life of a great number of your future patients. Remember, study the description of this video where you can find a link to free training classes on clinical hypnosis with several free ebooks. Possible relapses and their overcoming. Always remember that the desire to smoke can present itself at the most unexpected moment. During the preparation phase, you learned to make the acts of lighting a cigarette conscious. Now, faced with the possibility of lighting up a new cigarette or not, you always have the option of choosing one of the alternative behaviors that you initially prepared. If you light up a cigarette thinking that it will be one and only one, you have an 80 to 90% chance of starting a relapse. Do you think it is worth it? Remember the self-instructions about smoking just one cigarette. The more unconscious our actions are, the more automatic our behavior is, and the less able we are to consciously choose what we want to do. But this process is not inevitable. Automatisms can be broken. The more aware you are of the moments when temptation may arise, the greater your ability to control your actions and the greater your possibilities to choose what to do. There are effective ways to increase your ability to choose, and it boils down to identifying and anticipating risky situations, together with a clear definition of alternatives. Warning signs. In many cases, the symptoms of relapse appear long before use. Being able to identify these symptoms or signs makes it possible to prevent a relapse. Watch for these signs. Repetitive thoughts about using. These may take the form of thoughts about tobacco use, dreams or desire to start smoking again, etc. Defiant attitude towards the recovery plan. Criticism of the cessation instructions and treatment presented in this book. Neglecting the treatment plan, as well as not following the instructions and recommendations in this book. Not doing the prescribed exercises, etc. Feelings of frustration and/or impatience because the desire and need to smoke does not disappear as quickly as we would like. Irritability without apparent cause, mainly directed at people who have helped or encouraged us during the process of giving up smoking. Obsession with image or consequences of treatment. Excessive dieting, preoccupation with weight, etc. Floating feelings of depression and anxiety. Negative emotional states that are not necessarily related to any external event. Frequent arguments at home, family, at work, and in the circle of friends. Insomnia, restlessness, and difficulty resting. If a relapse occurs in spite of everything, do not inhale the smoke. Try to use low nicotine tobacco. Breathe in less with each puff. Leave and extinguish very long cigarette butts. That is to say, do not use up the whole cigarette. It would be advisable to throw it away halfway through smoking. Remove the cigarette from your mouth between puffs. Do not keep the cigarette in your mouth all the time, only during puffs. It is advisable to use filter mouthpieces. Avoid alcohol and stimulants, coffee, tea, as much as possible, as they induce smoking. Delay lighting a cigarette as long as possible. You are going to light a cigarette, then wait 3 minutes. Have you been able to hold out for 3 minutes? Then wait another 3 minutes. If you are able to keep these waiting times, increase the waiting interval by 1 more minute every day. Can you also start again? Keep going. Relapses are not a step backwards, nor are they a failure. If you are methodical in your plan, success is certain. Many people go back to smoking cigarettes after quitting for several days. If you managed to quit for a few days and then relapsed, now is the right time to try again. And there are other things you can do right now to quit smoking cigarettes for good. Reconsider why you started smoking again. Analyze what happened or where you were when you started smoking again, and try to avoid or prepare for those situations in the future. Don't think that you have failed. Remember that many people go back to smoking cigarettes before they are able to quit completely and for good. Think about other difficult things you have managed to overcome in the past, and think that if you were able to overcome that, you will be able to overcome this too. Watch your thoughts. Thoughts can either hurt us or help us live better. Negative thoughts can help bring us down, while positive thoughts can help us better ourselves. Instead of complaining about how hard it is to quit smoking, you can say to yourself, although it is difficult, it is not impossible. I'm capable of quitting smoking. I want to, therefore I can. Want is power. I'm capable of achieving anything I set my mind to. When thoughts like, I'm going to die anyway, everyone dies, come to mind, think, I will live my remaining years healthily, happily, and with a better quality of life if I quit smoking. Find other ways to keep yourself entertained. Many people go back to smoking because they feel bored or depressed. Find interesting and fun things to do that will help you forget about smoking. For example, go to the cinema, walk in the park, go shopping, visit non-smoking friends, go hiking, read. If you have relapsed, don't quit for tomorrow, quit today. Don't put it off for one day. There is great satisfaction in having successfully quit smoking in the past. Even if you are worried right now that you have relapsed, remember that the best time to quit and start again is right now. Also remember that your health and the health of your family are more important than any worries you may have right now. If you have relapsed, quit smoking today. If you fall, get up and walk again. Read the book again and review it. If there's anything you didn't do the first time you read it, do it now. The more techniques you use, the easier it will be to quit smoking. If you're interested to continue learning about clinical hypnosis, watch our next video, Motives to Quit Smoking. Remember to study the description of this video, where you can find a link to free training classes on clinical hypnosis, with several free ebooks as well. If you have questions, add them in the comment area. About this topic and many others, we'll talk about in the channel and in the videos that we'll publish. So, if you're interested, don't miss our next videos. Thank you very much.